Hi, this is Jason Kilmer from the University of Washington, representing Washington's Young Adult Health Survey with a short video on actual and perceived norms around cannabis use. The Young Adult Health Survey is an annual survey funded by the Division of Behavioral Health and Recovery within Washington's Healthcare Authority. We collect data from 18 to 25-year-olds here in Washington state, and they're recruited using a combination of a direct mail invitation sent to a random sample from the Department of Licensing of 18 to 25-year-olds in Washington, as well as advertisements on social media platforms. It's a completely confidential survey in place for 10 years, and it's allowed us to take a look at what changes we've seen in Washington over time. Now, we collected as much data as we could in 2014 before cannabis retail stores opened, and that allowed us to have kind of a pre-time point to then look at, as we look at new groups of 18 to 25-year-olds, what the impacts of cannabis legalization have been. Why are we talking about norms? What do we know about perceived norms? Decades of research show that when people think use is more prevalent than it is, or at a higher intensity than it is, that's a contributor to people's decision to use a substance. If someone genuinely believes everyone uses a substance, they're more likely to start, especially if they want to fit in. If someone uses a substance every day and is considering making a change, a barrier to changing might be, well, everyone else uses all the time too. And if we can correct a misperceived norm, we might actually boost and support the confidence and optimism that someone considering change can do so. Now, with cannabis, Sandra Wolfson is a researcher that showed that the most pronounced misperceptions of cannabis use tend to come from those that use most frequently. And while these misperceptions might exist, they can also be corrected. What I'm going to show you, going left to right, are data from cohort 1 and then all brand new cohorts over time. And this is any past year cannabis use for non-medical, or in quotes, recreational purposes. We largely talk about non-medical use and medical use. For the purposes of this video, I'll be talking about non-medical use. The line you see right here is 18 to 25-year-olds in general. And if I draw your attention to the far right, in 2023, in cohort 10, you can see that non-medical use was reported in the upper 40s in terms of the percentage of people reporting any use. So what's the flip side of that? Over 50%, most aren't using. When we split the data by 18 to 20-year-olds for whom use is illegal, and 21 to 25-year-olds, those with legal access to the retail market, we can see that these really split over time. We've seen, in general, an increase among 18 to 25-year-olds in past year non-medical use. We see that what's driving that are the 21 to 25-year-olds. At least monthly use, that's going up over time, and it's similarly the 21 to 25-year-olds driving that increase. At least weekly, that's significantly going up since stores have opened. And that's, again, largely driven by 21 to 25-year-olds. Daily non-medical use, you look at that orange line of 21 to 25-year-olds, you see that it's almost 14% reporting that they're using daily. And that certainly becomes noteworthy as we look at things like risk for cannabis use disorder or addiction. Now, there's a lot going on this slide, and I'll try and explain it to you. But we ask people about their personal behavior. How often do you use? And we give them the options you see on the left. We then ask them, how often do you think the typical person your age uses? And we give them the same options. Now, you saw most people aren't using. Yet it's only about 2 to 3% of people that get that right. People tend to think, I think the typical person my age is using. And in some cases, they estimate using pretty frequently. If we look at the bottom at daily use, go to the far right in 2023, 19.02% of 18 to 25-year-olds in Washington thought that the typical person their age was using daily. That's just not the case. And again, these misperceived norms matter because they can lead to people initiate use. They can actually be associated with people who are already using, continuing to use in a pattern with increasing frequency. In cohort 10, 20.84% used at least weekly. So 79.16%. The flip side, don't use. However, in our sample, 69.29% think the typical person their age uses weekly or more. So there's a lot of work to be done. And there's also opportunities to correct misperceived norms. Something available to people in Washington state who are between the ages of 18 to 29 that's free, anonymous, and I can't say enough times, free, thanks to the Healthcare Authority, is check in with yourself. You can use the QR code you see on the screen, or you can go to checkinwa.org. 18 to 29-year-olds in Washington can fill out a short survey about their alcohol use or non-use, their cannabis use or non-use, their mood, their connectedness, their loneliness, their coping, and then get personalized feedback about that information in those domains. One of those domains, cannabis use and norms. So if this is of interest to someone you know, if you're watching this video and this is of interest to you personally, and you're between 18 and 29, this is an amazing resource to be able to access.